Dr. Darien is back with us, and in the aftermath of something like a big wildfire, there are other health risks just from being in that smoke that people need to be thinking about.
Yeah, many people may not realize, as we discussed previously, after that fire is extinguished, that risk unfortunately still exists. When we look at prior studies in terms of wildfires and presentations to emergency rooms, there have one study from the American Heart Association from 2020 that shows that the risk of cardiac arrest, heart failure outside of the hospital increases upwards of 70%.
Wow.
And some of the reasons why it can be, bring it back to biology. When we inhale those small particles, they can get into our circulation, causing inflammation and increasing the risk of blood clot formation. That increases our risk of heart attacks, blood clots in our lungs, like pulmonary embolisms, as well as strokes. So it's so important to pay attention to your symptoms, especially if you're in these environments.
And what are the symptoms again that we should be on the lookout for?
Yeah, so for heart attacks, it's the symptoms that we all know well. Chest pain, that squeezing pressure. For women, they might present differently. For example, jaw pain, nausea. Sometimes it can just present as back pain as well. Often when I'm asking these questions, it's in the setting of exertion. But you have to remember, not only are we exerting ourselves in these moments, but also the grief that comes along with this can put significant strain on the heart. And as far as strokes, numbness, tingling, if you have any of these symptoms in these events, know that you have increased risk and seek out help.
Because your body is in a stressful situation.
Yes.
Like this, on top of the air.
On top of the air. And many people discount that, but it's so important to recognize.
All right, Doc. Thank you very much. We appreciate it.